Today, on the occasion of International Women's Day, Department of Panchakarma, Faculty of Ayurveda BHU, is organizing online guest lecture series. This is for our diploma students. It's offline. For that, we have invited Dr. A. Ramya, Associate Professor and HOD, Department of Ashtamgam Ayurveda College. So I welcome you, Dr. Ramya. As we all know that in women's health, as we know the International Women's Day, the Panchakarma has a benefited role because without Panchakarma, a woman cannot be healthy and happy. Her wellness will not be pertained or her wellness will not be maintained without Panchakarma. This is the utility of Panchakarma in womanhood. In Panchakarma, we have the mental health for the female, emotional well-being. For emotional well-being, we need the Panchakarma. To enhance the overall healthy life for a woman, we need Panchakarma. Of course, for the beauty care also, for hair and skin also, the Panchakarma has a very good effect. So for this, I formally invite you, Dr. Ramya, for the formal introduction. I invite Dr. Varuni to introduce Madam. Over to you, Dr. Varuni.
Thank you, ma'am. Good afternoon, all present here. It is an absolute honor and a privilege to welcome an Ayurvedic author, professor, doctor, and a visionary in the field of Ayurveda, Dr. A. Ramya, ma'am. With a profound commitment to our own science, Ayurveda, ma'am has not only mastered the art of Ayurvedic healing, but has also contributed immensely to its academic and clinical advancement. She is professor and head of Department of Panchakarma and former vice principal of Ashtamgam Ayurveda Vidyapeedam, mentoring next generation of Ayurveda practitioners. In addition to her portfolio, she has published 20 articles like Decoding Detox, Health Begins at Home, and has been author of several books, 3 Doshik Diary, a compilation being one of them. Having an experience of more than 11 years of graduate teaching, she has been a faculty of Panchakarma at various Ayurvedic colleges and in many webinar e-learning platforms like Samiksha Ayurveda. Beyond academics, she has been actively involved in clinical practice. Ma'am has served as specialist consultant for neurocare at various hospitals and runs a special OPD at her own institute for neurodegenerative disease. Dr. A. Ramya, being an excellent clinician, has been invited to many conferences and CMEs. With such an illustrious career, it is truly a privilege to have Dr. A. Ramya ma'am with us today with the topic Precision Panchakarma for Positive Womanhood. Thank you, ma'am. Over to you.
A very good evening to one and all. Chaturmukha Samarambham, Vagbhidacharya Madhyamam, Asmadacharya Paryantam, Vande Guru Paramparam. Ragadi Rogan, Satadana Shaktana, Sheshakaya Prasadana Sheshana, Utsukya Moharadhitan Jagana, Yo Purva Vaidyaya Namostu Tasmai. So, invoking the blessings of all Acharyas of Ayurveda, I am very happy to be a part of this session, to be a part of this platform from a very renowned institution like Banaras Hindu University. And I'm very happy that my senior Dr. Rajkala Madam had given me this opportunity. So definitely next 1 hour, I would share some of the thoughts on, the precise Panchakarma to nurture a very significant womanhood. So I'll just share the screen. Yeah. So I think the very fact that on March 8th, International Women's Day is celebrated to actually nurture womanhood. And why? Probably the fact remains that to a great extent, women who was actually considered to be the greatest throne or the greatest support of the societal system was many a times sidelined, and it was actually imperative for the society so that we need to bring in a support system wherein her importance is highlighted, her issues are discussed so that we have a better society. So we all know, these stages of womanhood, right from the girl child to the young lady, to the old women. And culturally, I think India is one culture wherein, this womanhood is celebrated at every level. The so-called Shakti is prayed at all levels. All our great beings, Adi Shankaracharya, Swami Vivekananda, Ramakrishna Paramahamsa, all have actually been nurturers of Shakti. So this importance and subtlety of Shakti was understood, but the fact remains that people who go beyond or before Shakti had never treated in general women at par with them at the societal level, which is actually the reality at the ground level. So we all know, feminine is basically the subtler dimension of human existence. And when we say Prakriti and Purusha Purusha is with Chetana, but Prakriti is the dynamic factor in the background. And femininity, when we assess, it is femininity and masculinity. And femininity, when we observe, assess, I think being physicians, specifically, I think as Ayurveda physicians, it is more complex, more intense, it is more subtle, at the same time very beautiful, attractive, which is needed for the generation to move on, but at the same time physically, mentally and emotionally complex at various levels. So to understand this particular sensibility at every level, I think is very important. And as when we come to Vaidyatum basically, as we all know, is beyond gender. So for a Vaidya or for a Vaidyan, to consider, whether the other person is a male or female is not a factor, because we know it is ultimately, the Chetana, the Atma that actually defines the whole life. At least Ayurveda puts forward that. But the fact remains that when we live in this society, with this socio-cultural background, as Ayurveda physicians, we need to have a clear-cut idea about, what can we as Ayurvedic physicians do to the women, to the women generation. And I'm sure that 80% of our Ayurveda academies are all full of women. So when we think of womanhood, we all know actually the moon and feminine is always connected. The lunar cycle, wherein the human female menstruates every 28 days, has got a very subtle link with that. So Ayurveda that basically decides, or Ayurveda that basically has seen human being as a part of macrocosm, the microcosm in macrocosm, has also understood this subtle relation between the feminine and the moon, which is actually Saumya is Shukram, but at the same time, the women is actually represented by the Arthavas presence, the Agni's presence, but the cycle is at the level of lunar system. Now, when we think of why women's health has to be considered, the fact remains that women is the key to maintain familial health, supports the societal health, and ultimately to maintain the child's health and support to the health of next generation. It is women's health that is most important. But the fact remains that still women is a vulnerable group in our society. And national statistics suggest that generally diseases women are more prone to, whether it is nutritional, musculoskeletal, psychological, whatever. And the statistics from Kerala states, even though women are socially and educationally much better, but physically and psychologically, women are below men even in Kerala. Now, when we come to discussion of women and Panchakarma, within 1 hour, I would like to communicate something, some specific things that has actually come to my mind when we think of womanhood, and possibly how Ayurveda looks at it, and how Ayurveda, how Panchakarma, the backbone of our Ayurveda treatment, has got specific inclination. Was there an inclination? To a great extent, when I used to study, during my BMS, I always used to feel all our texts are basically patriarchal. And, women specific was actually confined to the so-called Yoni Rogam, and she was considered as the most Vrishya Dravyam for Rasayanam. So, the perspective towards women as a Dravyam and all, when we used to learn Rasayana Vachikarna and Kajikitsa, I used to have a very defined thought process regarding that. Why is this considered? But of course, it has got many socio-cultural thought process, which we will not be going on to it. We will be thinking of the medical perspective of womanhood and how we can deal with it. But the fact remains that Ayurveda has represented what was actually the need of the society and what was the real situation in the society. In many, you could see among the Sadaturas and people whom should not be told all secrets, women is a category. So all these perspectives, we could see, what was actually societal reflection of women when we go through our classics also. But however, we know from the menarche to menopause, when the women's life move on, we know women was actually observed through, 8th Ashayam, Garbhashayam is present in the women, Ayurveda specifically mentions. And when we think of, compared to male and female, the feminine is Ushna, the Shukla Dhatu is Saumya, and when it becomes from Rasa to Rakta, then Rakta to Mamsa, in between Artava has to move out. Since the body cannot hold the Ushnatvam in the body that is represented or just understood to be in the feminine, the body has to naturally remove the excessive Ushna from the body for the cycle to convert. So it is this excessive Ushnatvam or Ushna Guna that goes out of the body through Artava. So naturally, whenever we are seeing the women as a persona, we always have to be having this understanding of presence of Ushna Gunam, presence of Agni in a female. So whenever, the role of Rakta Mokshana, the role of Sweda Kriya, the role of Virechana, I think whatever when we have to think of that, this perspective have to be understood at all levels. So when the Ahara Rasa to Rakta to Mamsa to Medas, this Dhatu Parinama happens, it is women who throws out the so-called Artava, and when Artava is not coming out, it becomes usually physiologically there is only other possibility of having Sthanya, the other way, which is most Saumya Bhava of the body. So this Ushnatvam of the body, since the Ashaya cannot hold, it has to deliver it out so that the regulated maintenance of Ushnatvam happens in the body so that the metabolism moves on. So naturally, this timely shedding of the Rakta or Arthava through the Rutu Chakra is basically to maintain the optimum gunam of, from the Shita Snigdha to Ushna Snigdha to Ushna to as we move on, again from Ushna to Shita, then Snigdha to Ruksha as the person ages. So ultimately life is from Ushna Snigdha to Shita Ruksha. So when death happens, Mahadevan sir always used to say, Shita Ruksha is ultimately death. So Ushna Snigdha is, since the body's metabolic, its maintenance, ultimately we have Sneha Svedas as a large spectrum of treatment protocols, because ultimately it is Snigdha Guna and Ushna Guna, regulated Ushna Guna that maintains the life process move on. So to maintain this regulated Ushna Guna in the body, definitely this regulated shedding must happen from a woman in her proper period of reproduction, which is from, Kapha to Pitta, then Pitta to Vata. When Pitta diminishes and Vata increases, definitely the menopausal stages comes out. So it is during the menopausal stage, the so-called dislodged Pitta or the so-called very disbalanced Pitta that represents through various symptoms that we see in the menopausal women. So as we all know, whenever we think of menstrual issues, whether it's dysmenorrhea, amenorrhea, menorrhagia, oligo, hypo, I'm not going to deal with these issues in this spectrum, limited time frame. what we could understood when we think of any of the abnormalities of menstruation is a disturbance of this cycle. The cycle, when the body has to shed regularly the excessive Ushna Guna from the body as the Artava. So there is a problem. If it is excessive, we could understand where is the issue. If it is low, we can understand where is the issue, whether Kapha or Pitta. This understanding primarily we can have. So when we think of Ayurveda as a science, we all know that, Ayurveda has touched the physical, mental, psychological, socio-cultural aspects of human beings at all levels. And it has interpreted factually, scientifically, and clinically in relation to macrocosm and the environment, how a human being can survive in the world through the intellectual processes. So when we think of, these three, right from the girl child to the women who has to have multifactorial, multiple roles that specifically today's women has to tender to the elderly women. Definitely when we look through the history, the women of 2025 is definitely privileged than the women of 1985 or 1995. There is no doubt. From last 20-25 years, definitely the generation that has moved on for last, maybe our generation is privileged in many factors. Because the fact remains that when technology replaced the physical strength, when many of the things were easily done by technological activities, or when the physical naturally, women who was emotionally and intellectually equally competent had more space as the things moved on. And when we think of Ayurveda as such, Ayurveda basically is always a thinking science, the way we could define it the best. Because it's not just a techno-medicine, but ultimately, it's not something that we can conclude through some blood test, or you go for a nerve conduction velocity or EMG or EEG. Rather, it is for treating the patient, ultimately we have to be aware of this movement of gunas. How the samprapti has moved from one particular adhisthana to another adhisthana, and what is the nidanam that is specific for making that samprapti affinity towards a particular dhatu, how that movement is happening, and what is the stage where the patient or the individual is going on. This is actually a continuous thought process, and that is the strength of Ayurveda. At the same time, if we are unable to tend to it, that is of course the weakness also. There is no doubt about it. And we all know that Ayurveda can be best defined as actually the bedside functional interpretation rather than a technological reconstruction of the bioprocesses. Because, if the headache happens in the afternoon time, definitely Pitta's presence is more. There is no doubt about it. And by the evening, the headache reduces. If the female comes and tell doctor, I get up every day at 2 o'clock or 1:32 in the night, I just get on with it, and then my sleep gets disturbed. Next 2 to 3 hours, I feel very disturbed and all, and by morning 5:30 again, I fell asleep. We could see the Pitta's presence, which is also high in the mid of the night, madhyana of the ratri also, which is very important to understand. There is Pitta Dushti in the female that's moving on. And you have to be going for some other medication like Shatavari, Chinnaruhadi or Manjishtadi in the background. So this what you call it as observation of the patient's response to everything in and around is very important. And as we all know, it is the time-tested wisdom. So when we think of womanhood also, we need to be observing, we need to include the same principles over there. Because as we all know, the only science, which says, other than, the Samadosha, Agni, Samadhatu, Malakriya, which represents the physiological and the functional aspect, Prasanna, Atmendriya, Manatvam is important for being Swastha. And what is Swastha is actually Sthiti in Swatvam. So, being within oneself, that is Swastha. For that, Prasanna, Atmendriya, Mana is happening. So when we come through the womanhood, the stage of womanhood, from the child to the pubertal woman to the young lady to the phase of motherhood that a woman faces on, then towards the menopause and the elderly, we could see how the gunas change from kapha, moves on kapha pitta at the peak, then pitta kapha reduces, pitta at the peak, pitta plus, then pitta plus vata plus, then pitta plus vata plus, then pitta kapha comes reduced and vata becomes more. So this sequel we could definitely observe. And when the women is given with more peshis, 20 more peshis or 8 ashayas, etc., with more excessive structures in the body, etc., it is intended to be catering for a very important need that the Prakriti intends, that the life, the process of life continues. And hence this extra responsibility of women is one of that the Prakriti has given us, is one aspect that actually makes a woman more subtler in dimension at all levels, whether it is emotions or whether it is even the physicality, even the mental plane, everything. So in that perspective, when we think of the mental and emotional plane, in the present situation, I feel it is the most affected when we live in a socio-cultural condition wherein, presently our physical needs of eating food and basic physical structure of food, clothing or other circumstances are to an extent tended to. But the emotional plane, next comes the mental and the emotional plane, the so-called manas or sattvam. When Ayurveda speaks about sharira, indriya, sattva and atma to be jivitam, it is the samyoga of all these 4 levels. So definitely from the sharira to the indriyas and sattva level, these 2 things have to be tended to a greater extent to that aspect. And the fact remains that in our clinical observation, the only factor, stress, whatever the reason be, the chintyam, vicharyam, uhyam, dheyam, sankalpam, etc., which are actually the artha for manas. And when the karma of manas in the format of indriyabhi nigraham, swasya nigraham, uha, vichara is getting affected, a great lot of diseases manifest in the female, causing all tridosha visheshan. There is no specific that vata, pitta or kapha. It is generally the tridosha visheshan. So when we come to the from the young female to the common issues that middle-aged females, whether it is low back ache or the young females, they face the PCOD, as we all know, or the menorrhagia, the menopausal syndrome with hot flushes, sweating, mood variation, irritability, etc. We could see the difference or changes in this gunas. And I think understanding this movement of gunas, when menopausal syndrome, very asthira pitta with vata dominance, when DUB, wherein pitta plus in the background, when in PCOD we could see kapha and pitta to an extent, but kapha more in the background. And so this movement, once we are able to understand or subtly observe, I think we will be able to come to the precise panchakarma needed for the female. So as we all know, whether it is Vamana, Virechana, Vasti, Nasyam, whatever it is, how to decide which is the best treatment in that aspect in general, I think we definitely have a lot of what you call it as guidelines that is kept in our kept in front of us. So with this background of subtly observing the female with respect to the gunas presence, of course, clinically we do understand we have to be observing which dhatu is affected, etc. But generally, when I wish or when I want to look at womanhood as a whole, we could see the changes of the gunas. And we could actually move on by understanding the primary doshas that is involved and the needed treatment. So I think with this background, I have tried to come down to our topic of precise panchakarma for the positive womanhood, whether, the woman is at the menopausal stage, or she is suffering from a menorrhagia, or she is having PCOS or low backache because of XYZ reasons. So when we think of preventive aspects, solutions, definitely we as Ayurveda people definitely have the preventive protocol as well as curative protocol. When we think of preventive aspects, when it comes to the Panchakarma, we all know ultimately what Panchakarma does to the body is actually stimulating the body to respond to a challenge. We know we go for Vamanam in PCOD, we go for Vamanam in pre-diabetic stage, we go for Vamanam in Unmadam, we go for Vamanam in Mukhadushika, we go for Vamanam in Pushtam. Ultimately, in all spaces, our target of Samyak Lakshanam is Pittantam. And when it comes to Pittantam, it is bile released from the liver. Ultimately, there is a stimulation that's happening to the liver that's happening there. So whatever the methodology that we are intending or we are making the patient to undergo, it is ultimately stimulating the body's intelligence to respond to whatever stimulus, and that response is actually the cure. We are challenging the body in a regulated way, and when you go for head bath, it is a part of dinacharya. When we make ourselves wet in the rain, what happens? We suffer from some kind of cold, which is again pathological. But at the same time, when we give manjishtadi kshiradhara or takradhara or shiro tailadhara, we are regulatedly using the same method over the head by using some specific medications. So we are challenging the body in a very regulated format so that the body responds to the stimuli that we are giving. So even when we are treating the so-called women or whoever is approaching us, ultimately we are actually challenging the body to respond to the stimulus that we are giving through the various procedures, whether it is Purva Karma, Pradhana Karma or Paschat Karma. So as we all know, all the Kriya Krama that we have are the various therapies which are the most important weapon that an Ayurveda physician has. And ultimately, our challenge being Ayurveda physician is basically these variables. When a patient with low backache come to us, should we go for a Vaitarnavasti initially, or should I go for a Sankarasvedam or Avikiri or Mukikiri as we told? I mean, tell here a different kind of Sankarasvedam, or should I go for a Dhanyamla Dhara? If I go for a Dhanyamla Dhara, should I do it for 30 minutes or 40 minutes, or should I do it in the morning or evening? Should I do how many days should I plan? So these things are the variables which have to be specific as such. So how should we move on to be having more and more clarity regarding this specificity is our ultimate challenge. So when we see Dhanyamla Dhara is indicated in a play, because when I see the low backache case is coming up, she is having, Pittanubandhatum in the background. I could see there is some Sparsha Sahishnutum, etc. Definitely then Drava has to be taken. Potala Sveda, Pinda Sveda should not be done. When Potala Pinda Sveda has to be considered more of Vata Kapha, should I go for an Avikiri or a Mukikiri wherein the same potli is dipped in Dhanyamlam or the vapor from the Dhanyamlam is manipulated to make the potali? What should be the method? So the same Dhanyamlam, something is becoming vapor and giving more Kafaharatvam when compared to Mukikiri, what we call wherein the potli is just dipped in the Dhanyamlam and heat is manipulated. So in practice, whether should we go for an Avikiri wherein the potli is just heated in the vapors coming from Dhanyamlam, or Mukikiri, what we call wherein the potli is dipped in the Dhanyamlam, it is actually the involvement of the range of kapha that decides which has to be done. So this specificity we already have, and I think this specificity is something that we need to bring it in our practice. At the same time, should I go for 30 minutes procedure or 40 minutes procedure? Till you could see Sveda Srava in a patient. If a patient, we do Dhanyamla Dhara to X patient, he starts sweating with all sweats in the forehead, nose, etc. after 30 minutes. And if we continue it for a longer period, he may go for Atisveda. At the same time, somebody else, even after 40 minutes, he's very cool. That means his Sveda can be continued. So in that perspective, Sveda Srava can be a objective finding that we need to observe in the patient on a daily basis. Then Shita Haratvam, Stambha Haratvam, Gaurava Haratvam can be observed in a phase-wise space. So this understanding of how to assess the Samyak Lakshanas is actually our guideline, how long the procedure has to be done or how much the procedure has to be done. So this clarity as Ayurveda Vaidyas, we must have as Panchakarma specialists, we need to guide all other our co-people to have a clear-cut idea on this. So when I say which one to be selected depends upon the samprapti of the patient, the involvement of dosha and dhatu, the age of the patient, and the kala or ritu of the patient. So the specific utility of Kriya Krama is basically intended for the fast, best, and long-lasting effect in the patient. So as we all know, Ayurveda is actually the method of understanding and unveiling the gunas and its yuktivat prayogam. So when we think of the preventive aspect, as we all know, we cannot forget the dinacharya, which fine-tunes the body to daily challenges. So a woman getting up in the morning time, tending to her daily course, having an early dinner, sleeping an earlier period, having a good lifestyle is very important to maintain her health. So, the process of in going for Abhyanga followed by Vyayama and regular snana after that particular process, not the mid-afternoon snana that usually many females do practice in Kerala after, they make their husbands, if they're housewives specifically, they make their children go to classes, they make their husbands go to work and all, they do all household activities and they do take bath in the afternoon period. And, in Kerala, when they are used to the practice of going for head bath in the afternoon, that itself is one of the common reason that results in neck pain and low back pain that continues for a longer period. So, this kind of habitual aberrations away from the principles told in Ayurveda, I think is one of the reasons that makes a woman more prone to various disease conditions. I've seen many women who, have the breakfast and then immediately within half an hour or 45 minutes go for having a bath after that, which is again against our process. So following the dinacharya is one important thing that we have to take care. The Vega Dharana, which we all know, which I think modern medicine is still yet to come up with, such an observation. The Vega Dharana that happens to the women is usually, many, when they go to school or travel, they don't go even to go to toilet unless and until till they come back. So I think Vega Dharana is something that we don't very much specifically think when a pathology comes up to us in the OPD. So Vega Dharana, the Ahara Charya, timely food, nutritious food, having food when proper appetite happens, adequate water intake, the Ritucharya that fine-tunes the body to seasonal changes. So these all aspects have got its own relevance in the background of, preventive aspects or maintaining the health in general of a woman. So, whether it is Vamana, Virechana, the Vasantika Vamanam that we commonly follow or Sharadika Virechanam that we do, definitely has got a role in maintaining the quality of life. And the fact of, Himsaste, Manyata, Kamam, Paishunyam, Parishan, Rhythm, Sambhina, Labham, Vyabadi, Drigurparyam, etc. which are the Dashavida Papa Karma. So, when Acharya gives us that code of conduct, and we see, it is in Indriyopakramaniyam Adhyayam Charaka Sutra Sthanam, wherein Acharya specifically speaks about Sadvrutta, what to do. For doing Indriya Supakrama, it is very important. He speaks about Indriya Adhishthanam, Indriya Buddhi, Indriya Dravyam, etc. Then he speaks about Manas and how it is important to control Manas and to have a healthy ayus further. What are you supposed to do to have good Indriya and good Manas? You follow Satvritam, he says. This, I think, is not put over as a concept in healthy life by any other science other than ourselves. And the fact remains that, Hetu Irshe Phale Natu, and all those good things, at least Ayurveda people need to follow in our own lives. And, when we live all together with everyone around us, supporting, being inclusive of everything, Paishunyam, Parusha, Anrutam, Sambhina Labham, talking negative about somebody in their absence. All these things are told us actually Dashavita Papas. So I feel this aspect, and of course, many a times I have seen women more prone to these things to a greater extent. The fact remains, maybe because of her sensitivity or whatever, etc. I think that itself is keeping somebody towards rogam or making somebody rogi, because very specifically our acharyas has mentioned it is Dashavida Papas. So this following Sadvritam in life, I think, is very important for a woman to maintain good health. Now moving to our specific area of precision Panchakarma. So from, the preventive aspect of following Dinacharya, Rutucharya, Sadvritam, etc., precision Panchakarma, how can we think basically? As I mentioned, the women's life ultimately is something that expresses gunas movement. Different gunas we could see from how it moves from as we all know, the role of Vamanam and Virechanam becomes more important when she crosses 15 to 20 or, next phase. In the middle age, when she crosses 40 plus, 45 plus to 60, 65, the role of Virechanam and Vasti will have more important time. And when the elderly phase comes to definitely we all know the role of Yapanavastis. Different Yapanavastis has got the greater importance, and the role of Nasim we need to definitely explore. So when we see how can we precisely deliver these Panchakarma, I think the principles told in Jwara is ultimately our guideline. So I have put on some principles from Jwara that can actually help us to guide, not only in case of women in any way, of course in case of women in this perspective, that how can we precisely think that this patient is indicated for this particular thing. So, an attempt to traverse the vast terrain of different sampraptis, but Jwara is one area that actually guides us, especially with special reference to the different Panchakarma or Kriyakrama, that helps us to understand or, give clarity regarding where to do which procedure specifically. So I think, when we think of Jwaras Samprapti, specifically with respect to the female manifestation, it happens as an initial Samprapti of most clinical manifestation. That is my clinical observation. Because, when a patient comes to us and says, doctor, I have neck pain or low back pain, we always ask, this Gauravam is there, yeah, little Santapam, Tiktasita is there, yeah, evening, I used to feel very less appetite, This spectrum is common in all low back ache, neck pain cases, hypothyroid cases, joint pain cases, all psychological issues. In many spectrums, specifically when it comes to women, the Jwara Samprapti can be observed in most of the initial clinical, initial phase of any disease, it is ultimately the jwara samprapti when it becomes viruddhaharaihi vidahyannam viruddham cha tadja asrak pradushanam. So when he specifically moves on to vidahyannam viruddham cha, that it becomes vataraktam. Then mityahara viharaihi, it becomes kushta specifically. Then mudga kodrava chanaka etc. specifically it may move on to udavarta spectrum. So this moving on from jwara to different things further is basically the specificity of the nidanam, and of course the already existing problem at the dhatu level that actually leads the patient to move there. So when we see in the clinics a female 45-year-old neck pain, low back pain, and she presents with feverishness. Even male patients who have weakness of bilateral lower limbs, urinary incontinence, numbness, a clinical condition of transverse myelitis. Even there we could see jwarasa samprapti. So when we say jware, langhanam evadau upadishtam. So primarily when it comes to langhana, otherwise kshaya anila bhayakrodha kamashoka shramodbhavad, except in those spectrum of diseases that has kshaya anila bhaya krodha kamashoka shrama etc. as the specific nidanam. In all cases, specifically in today's antarpanotthajanya vyadis, langhana is an important factor. So when we see of langhanam svedanam kalaha tiktakaha yavagaha, means yavagu and tiktaha rasaha pachanani, that is told for taruna jwara. All spectrum of myofasciate is in female, that that the young females coming up with headache, neck pain or chest pain, abdominal pain, general pain, all this spectrum, the whole spectrum of hypothyroidic clinical presentation can be dealt at this level. When we start with even Pachanamritam Kashayam, Tikta Pajanam in the spectrum of Amritottaram, Shadharanam, Pachanamritam Kashayam, Kalam, wait for some time. And I specifically used to give only Dashamula Peya. You just make Peya with the Dashamulam Kanni, we call 2 times, and have Vaishwanda Churnam twice daily before food. Wait for 3. Of course, when I say this, it's not just acute cases with acute symptomatic management where we are needed, we need to work out. But when it comes to the different sampraptis that a female present, our approach has to be in that perspective. So, the Pachanani Doshanam Tarna Jware. Somebody's mic is unmute, right? Yeah. So when it comes to Taruna Jwara, Pajanam, in all this spectrum is clinically important, wherein the initial, this I follow generally in all young females who comes from 25 to 35 age, 20 to 35 age with the spectrum of hypothyroidism or myofasciitis. And ultimately, when we give Ushnodakam, Deepanam, it becomes Deepanam, Pajanam, Srotasam, Shodhanam. This we never follow. We simple advice of you continue your internal food intake or whatever your daily gaze with, just boil water with ajamoda or little jeera and then have only hot water. This thing we always forget. Because I feel, this young females who are from the stage of kapha pitta, all their clinical manifestation starts in the background of jwara only. Now, when we say, at what stage the patient has to be introduced with the snehanam, kabe mande vada pittotare, that is the basic specific background of sarvipana. So whenever, after initial Pachanamritam, Amritottaram Kashayam, Shadharanam Guliga, Dashamula Peya, etc., this may continue for, initially I give for 3 weeks, then 1.5 month or 3 months. As the Samprapti moves on, he presents with Samyak Lankhana Lakshanas of Vimalendriyata, Sargomalanam, etc., Kshutrat Sahodaya, etc. Then, when we say this Kapha Mandavastha and Vata Pittottaravastha, we introduce Sarpis. This introduction of Ghritam is very important in the female patient because generally, as I mentioned, female is always that Agni's Amsha is there in the body. and Gritam has got a special affinity towards female. I do have a few cases of females who, who are regularly put on Kalyanakam Gritam, and after 45 days, I just ask them, you just stop it. And then after 10 or 15 days, they come back. Doctor, again, I have some difficulty. Otherwise, you just prescribe again with that and all. So, usually in this spectrum, the medications that I use is Kalyanakam Gritam, Tiktakam Gritam, Indukantam Gritam. These three things I generally use after the initial Amapachana spectrum of medication for 1.5 or 3 months. Then I maintain the Snehanam. Because ultimately, Snehasaro Ayam Purushaha. So ultimately, it is important to maintain the snigdhata of the body in the regulated fashion so that health will happen in the body only through this introduction of snehana. The different gritas that is told in our text. So, after a particular stage of Kashayas, as I mentioned, introduction of Gugulu Tiktagam, Tiktaga Gritam. Gugulu Tiktagam I prefer generally in specific joint issues. This myofasciitis spectrum and all, I prefer, Tiktagam. And then when there is involvement of Manas, as you all know, Kalyanakam. When there is specific involvement with special reference to Vadarakta, Meha, Spesa, Symptom and Asti Majja involved, Gugulu Tiktagam. And skin issues, definitely towards the end, we move on to Mahatiktakam or Aragoda Mahatiktakam. Now, there is also one specific thing that I think we seldom practice. Like people, I always feel, like people have paracetamol for pain or methal for pain. There's low back ache or, some issues with whenever we see Pakvashe Gadavada Lakshanam, they must be trained to have Matravastis at home only. Because, Anuvasanam specific indication, Prakshina Kapapittasya, Trika Prishta Katigrahe, Deep.Agnehe, Paddashakritaha Prayunjita Anuvasanam. See, in all females who are, all 30, 40 plus, 45 plus, they come and present with low back ache. We give Gandharva Sadi, Gandharva Erandam, Rasna, Saptagam, Nagara Churnam, etc. internally. After a spectrum, Saptasaram or Sukumaram, if it is indicated at that background. In that spectrum, very specific clinical understanding of Anuvasanas. So whenever there is Trigaprishta Katigraham, Prakshina Kapapittam and Agni is high, he can be indicated for a Anuvasana Vasti or at least a Matra Vasti at home or at OP level or at the IP level, whatever the stage. So exact stage of making a patient whether she is indicated for a Anuvasana Vasti or not, when the doshas, the clinical presentation is at the Trika Prishta Kati. And the dosha status is Kapha Pitta Prakshina. For Snehanam to introduce, it is Vada Pittotre Kape Mande. For Anuvasana, Kapha Pitta Prakshinam, Triga Prishta Katigraham, but Agni has to be very high. So this is again the specific symptom. And where should we give patient undergo Sveda? Uddarda Penasa Shwase, Janga Parvasti Shulini, Vata Shleshmatmage Svedaha. Very specific clinical indication. Whenever the dosha is Vata Kapha, Janga Parvasti Shulam. So whenever there is Parva Asti Shulam in the background, any Parva Asti Shulam and Janga Shulam is there, definitely Sveda can be given. So with all these internal medication, when there is Parva Asti Shula is there in the background, I ask them to go for Vasa Svedam, Tunikiri we call it as, cloth, you just close the Pata Svedam, coming under Tapa Svedam. Just have clothes, just what you call it as, fold the clothes, make it into poultry, just heat it in tawa or something and just do it in the evening times if the patient is Sukumara. Or just boil Dashamulam, Kashayam and Puliyala. Puliyala is Chincha Patram. Okay, so just boil Dashmula Churnam and Puliyala in water and then just have Dravasveda in the afternoon, evening after the application of any of the oil, whether it is Murvan or Chinchadi. So if it is indicated. So wherever Janga Parva Asti Shula, which is very common in middle-aged women from 35 to 45, 50, 50 plus and all, this Sveda can be given, and at home we can go for Vasa Sveda, local Potla Sveda, even Drava Sveda when there is Pittanubandhatvam in the background. So Vata Shleshmatmaka background with the Janga Parvasti background, Sveda can be given. Now, where is the indication of Vamanam? As you all know, Tatrutklishte, Samatklishte, Kafapraya, Chale Male, the specific indication in the background of Jwara. So, Kafapradhanan, Utkleshtan, Doshan, Amashestitan, Budva, Jwarakaran, Kale, Vamyana, Vamneharat. So, Kafapradhanan, Utklesha, Amashestita, Dosha. That is his background. Utklishtaniti, Hrillasadina. How can we understand Utklishtavastha? Hrillasadi. So this again I have observed in hypothyroid female patients who come to us and say, doctor, we many means with the presentation I had a patient who had some skin issue in the leg. And on inquiry, she had irregular periods, and she used to tell, morning, I feel like I have something in the head and chest, and I feel like vomit. I have vomiting sensation also. Some kind of fluid comes out in the body. She was an engineering student. I had admitted her, and I had just checked her TSH, and it was 88 in the initial stage. She was not. Only we detected the hypothyroid condition. I had admitted her. Did Snehapanam, Vamanam to that. After Vamanam, after the first from 88, after Vamanam, it became 53. Okay. And then, of course, she was not having any technically other issues other than the skin issue and little laziness and all. And then I continued internal medication 3 months, 3 months, and then I had made her undergo some physical exercise, then a Virasana. After that, it became 23 or something. Then it became 8. But it took almost 1.5 years for me to make that 88 to become 8 as such. The patient was with me. Many a times there were other females who were again 2 or 3 of them who were again detected, but immediately they had started with Tylenol. But the Tylenol will continue throughout the life. If we get the case in the initial stage, there is always a possibility to reduce the thing. So over a period, this 1.5 month of treatment, her periods became regular actually. After Vamana only, her periods became regular, but TSH was reducing only phase by phase. That was my experience. So this understanding of Kapha Pradhana and Utklishta Avastha is indicated for Vamana. And we all know, Tani Upasthita Dosha Panchakarmani Kurveta. How Matra Kala Vicharaya. So naturally, Upasthita Dosha Chakrapani Kamat Shaka Tekta Koshtagamanena Linato Parityagena. So whenever we could see this, what we call it as doshas in the koshta, definitely which is very commonly seen in young females in the background of kapha. 25-35 females in the background of kapha pitta. Koshta's presence of dosha is there. Definitely we must think of a Shodhana Kriya only. Now, if it is Anupasthita dosha, it can lead to many other issues. I'll just share an experience with one of my females again. Her name was Rashida. She was 30-year-old. I always say this case as a very important case that has taught me about the Samprapti. This lady, she had come with multi-joint pain and swelling for almost 2 to 3 years. I had initially admitted her. Then, she had 2 children. CRP was raised, RA was negative. It was a kind of seronegative arthritis kind of spectrum. CRP was some 30-40. Joint pain, we could see it is in the background of Amavata. So, that case, I had given internal medications, Pachanamritam, Shatyadi Pachanakashayam from Chakradatam, Navayasam Bhutika, that Shatyadi is one thing that gives me very good results in this spectrum, and she had results, her symptoms were better and she was admitted. So I had gone for all Ruksha Prayogas. I had given her Amritotram Vaishwandra Churnavasti, I had given her Dhanyamladhara, I had given her Sankara Svedam with Kolakulatadi Dhanyamlam. Then I had given for, even this thing, Baluka Sveda, because her presence was almost Kapha plus only. All these cases, what used to happen was Agni was low. So after Amritotram Vaishwandra Vasti, Agni was better. So all these cases, what was the patient was clinical. Her pain used to reduce with the symptom. Next day when I go for rounds, she used to say, doctor, again I have pain. it is better, but still it persists. With these things, it was still persisting. So one day in the morning, when by 10:30 or something, so I was thinking with all these things, why it's not getting corrected? Because in Amavata, my spectrum of treatment itself, I mean, generally what is our practice is internal Amabhajana, external procedures. This Snehapanam, Virechanam, Vamanam and all is generally doesn't come into our mind at that spectrum. That lady, but when I went for rounds, 10:30 in the morning, she told, still I have heaviness in my chest, doctor, and I have this problem. Yesterday, Dhanyamladhara was better, but still I have this issue. Then, immediately I told her, I was thinking, we have to go for a Vamana. Okay, when Utklishtavastha, that morning Kapha Kale to Vamanam and all, now let us not see. I asked the sister, you prepare. Immediately Panchakarma preparation was Yashti Phantom. I went for rounds for 11:30 we will do Vamanam, I told. They prepared Yashti Phantom. Patient was brought to the theatre. Some Ushma Spedam was done. And then, she had some light food in the morning. She was given kanji only. Panchakola Peya, Dashmula Peya kind of things were given. So and I had made her drink the Yashti Phantom and she had good Vamana. Vamana in the sense, I would say Kapha was coming out. No, Pittantam was there. Kapha Chedana was happened. And after that, we had done at 12 o'clock in the afternoon. Okay. But patient, after that, she felt relieved of, lot of heaviness. Next day, her pain reduced. And after that, I had gone for, I think, Avikiri or 2 days, but her significant reduction in the pain happened and she was discharged. And she had come for follow-up after 1 month and she told me pain is now ready. She was put on internal medication. But to my surprise, the second follow-up, she came and told me with the happy news that she had conceived. And she was telling me her second baby was 8 years old and they were trying for a third baby for last 4 or 5 years. And of course, last 2 to 3 years, she was having this pain and all in the body. So it was becoming difficult. But she conceived naturally after this Vamana. Okay, so I felt, when we actually do the right thing at the right time, I had never thought of making her conceive or, I have never thought because she had never discussed that issue as a priority to me at all. She had always telling about joint pain, unable to do a household work. There was some stress in the background. This was the issue that always. But when she conceived and told me, doctor, this we had tried and we had actually left and this happened naturally. This was like Vamanam. After Vamanam, first follow-up after 3 weeks. 1 month and second follow-up after next 3 weeks, 1 month. I mean, after Vamanam, almost 2 months. She had UPT positive. So I felt, when you do the right thing at the right time, the whole metabolism gets corrected. Her ovulation came out to be right. Of course, she was having regular periods as such, but ovulation was not proper. That was the observation that they were doing. Periods where oligomenorrhea was there. So she had come out with that. So, doing the right thing at right thing is very important. That case always reminds me in the background. Now, when we say anupasthita doshanam vamanam, if the dosha is not upasthita, I will also share with you another case experience wherein the dosha was anupasthita. But my overconfidence had made the issues worse as such. Now, this was a female. Actually, during that, both cases happened almost within 2 to 3 months gap. Actually, I had attended a workshop in Vamanam. So I was thinking of more possibilities of Vamanam. So in that background only, I had done Vamana to Rashida also. So this kuti was Angel Jaco. Now what happened, I still remember that girl. So she had actually she was a 9th class student with good moderate build and she was having regularly neck pain, low back pain, mid pain and she was unable to carry her bag at back as such. Okay, she was unable to carry the bags at all. She was having severe pain and she was unable to move on. So this was happening always. And I had admitted some CRP was raised on examination, RA factor was negative. So some myofasciitis and some stress, psychiatric issues, psychological issues was there. So again, I had tried I had started with some Rukshna therapies only. So on the day of admission, 3rd or 4th day in rounds, she told I am having continuous Shavatu doctor. I am continuously sneezing. And so she was a 16-year-old girl, and she was sneezing, and and she used to feel gauravam in the head. So I thought she is indicated for a vamanam. Okay, so I told we will do vamanam to her. We need not prepare her. Tomorrow we will do vamanam. You give Utkleshna Hara today, and tomorrow we will go for vamanam. So in the rounds I told, and no snehapana, nothing, but still Utklishtastu. So I asked them, you give Masha Payasam for today. Tomorrow we will same Yashti Fandam only. We will not think of Madana Pippali. We will go for Yashti only. Let's see what will happen. And what next day she was prepared. Next day morning we had Yashti Fandam. 6 o'clock we were doing Vamana. We had given 2 or 3 glasses of Yashti Fandam. She had the drink and she was not having any, and nothing was happening. So, and 2, 3, 4 glasses, nothing was happening. And then, she started sweating and some kind of giddiness happened. And I again tried to make her drink a glass of Yashti, but nothing was happening. And she was presenting with all these things. So that sister had come actually, coincidentally at that time, her sister, she had come to visit some 7:30 in the morning. So I was like thinking, so I just came to see her doctor. Did she vomit? Well, no, we are under the process. So she told, basically I was also wondering where Amma told me that she's going to make to vomit. She never vomits, doctor. Whenever in our home, all of us we have some diarrhea and vomiting with food poisoning. She never vomits. She never has that bout at all. We always suffer. She never. So I was wondering whether she will vomit today or not. So that gave me an idea that, she was basically a Durvama. Always I used to, when Charaka has Durvama as an indication and contraindication in Vamana, I used to think, what is this Durvama? So some people are naturally Durvama, and she was that. And I was overconfident that I had not made her Snehapana, undergo Snehapana, Utkleshna, and I inquired with Utkleshna also. She had only little, Ulunu Paisam, like Masha Paisam. Much Utkleshna was not, but I was confident of her Bala, Kafanubandatam, and her Lakshana of sneezing and Shiro Gauravam, that Kafa is there. But she was Durvama. And what happened? And she did not vomit at all. She started sweating, little giddiness and all. Then, I gave her hot water and I asked them to go to room. I thought, breakfast, if they have some juice or something will happen. No, similarly, that will happen. Let us observe. And she was very uncomfortable at that time. She was made to go to the room. She did not vomit. And I thought she will urinate more or she will just have a loose motion. She did not have anything. She had 3 or 4 times she urinated by afternoon, and the evening she had only 1 time bowel. It was actually an ayoga, and you could see all Kandu Koda happening. But unfortunately, fortunately that I was expecting some Kandu Koda will happen, but Kandu Koda did not happen. But from next day, her Agni had completely gone. For 3 to 4 days, no Agni, and she was just having, prasekam kind. And then I had to again treat her Agni. I had to go for Amritottaram. This Amritarishtam kind of medication internally to correct the problem that was iatrogenic in the background. So there, the possibility was the patient was Durvama, at the same time the dosha was Anupasthita dosha. Okay. So these 2 cases gave me an insight. It is very important to understand the avastha specific. The female who is from 50 to 30 is definitely indicated for a Vamana, but of course the avastha is very important. Yeah. Then as we move on from Vamana to Virechana, as we all know, like very specifically, Pittamba, Kapha Pittamba, Pittashayagatam Haret Samsana. If it is Treen Malan, it is Vastihi. So Acharya says Pittam, Kapha Pittam, Pittashayagatam, and Vasti if it is Pakvashayagata. So, how will we understand this Pakvashayagata doshas, Pittashayagata doshas? How will we understand? It is through Lakshanas only. When Chakrapani in Siddhisthana, he says, Samiksha dosha aushata desha kala satmya agni satvadi vayobalani, Vasti should be done, only then Siddhi will happen. There, Samiksha iti, Chakrapani comments, Jnana Purvakam Avekshya. So it is with the Jnana Purvakam Avekshan of dosha aushata desha kala satmya agni satvadi that we will be able to do a Vasti to a patient. So it is not just you select any Vasti and do something to that. So in that context, see when Acharya says Virechana Asthapaneyoho Dosha Bedena Sthana Bedena cha Vishayam. So Dosha Beda and Sthana Beda is responsible. How to identify this Pitta in Pittashaya or Kapha Pitta in Pittashaya and Pakvashya Gatam? Some guideline is actually, there is Pakvashya Gata Dosha that has been told. Poshtagata Kapha, that is told in Ashtanga Sangraham. Poshtage Jataronitam. Arochaka Avipakascha To Tam Tamscha Kapha Sambhavaha. So, Arochaka will be there, Avipakam will be there, and what all Kapha Sambhava diseases can be there, it can be there. Jadharunnitam. There will be, distension of the abdomen. And Poshtagata Pitta, Mada Trit Daha. So, Trit Daha, burning sensation, and this thing, kind of what we call it as very wanting of water, thirsty feeling, Tritta. Daha is burning sensation. So, Vyapinoscha. So, when Pitta, we could see it as Trit and Daha. Kapha, we could see in the background of Jataronita, Arochaka, Avipaka. These are the only specific. We have Pakvashagata Vata Lakshanas. But Pakvashagata Pitta and Kapha Lakshana is not told in Shastra. Probably the reason is because it is not maybe since Pakvashaya is Vishesha Sthana for Vata, Pitta and Kapha is not very specifically observed clinically in Pakvashaya. But unlike that, Amashya, Koshtagata Pitta and Kapha, it is told since these Lakshanas could be identified as such. So moving from when Vamana to Virechana, Virechana can happen with this Lakshanas. When should we go for a Vasti? Vastistu Adho Nabe. Vadana Chikitsa principle. So, in a female, when the Samprapti, any clinical manifestation has a presence Adho Nabija, whether it is uterine, yoni, knee joint, whatever, Adho Nabija clinical presentation is there, we must think that there is a possibility of Vasti. Any Samprapti that starts with Pakvashaya, a headache can have its root in Pakvashaya. All our Purisharoda will have Shirashula. The Shirashula that we many times see in many patients response good with Shirvilvadi Dusparshakadi, because that Shirashula has got its response at the level of, it's Samprapti at the background of Udavartajanya Samprapti and Pakvashagada Samprapti or Purisha Vegaroda Samprapti. So we have to identify those. So if the Samprapti starts in Pakvashaya, or in the process the Samprapti has its fall in Pakvashaya or has its end in Pakvashaya, Vasti can be a possibility. So any patient, a female comes to you, when we assess the Samprapti, we identify this, Vasti has to be a part of the treatment. So for practically placement of Virechana, Pitta and Pittashaya, Kapha Pitta and Pittashaya, and for Niruha, it is Adhonabe. It is very specifically told Jvarakshena Sena, Hitam na Vamanam na Virechanam. Niruha is important. So the importance of Vasti in a female is, even though the patient is indicated for a Vamana or Virechana, but still because of XYZ reason, because of the status of the Agni, because in Vamana and Virechana, both Agni has got a greater role. In Vasti, since its action is at Pakvashya level, Agni's role is not much high. So Niruha can be a possibility when Vamanam and Virechanam cannot be performed in a patient, which is many a times relevant in a female patient. So Niruha can be done, whatever, as we all know, Nana Dravya, whether it has to be a Langhana kind of thing with Lekhana Vasti or at Shira Vasti, Shira, Do, Prasurdo, Madutaila, Grada, Treha, Khajena, Madido, Vastir, Vadagno, Balavarna, Krita. So that spectrum, whatever, Niruha can be a possibility when the Samprapti starts, ends, or in between, we see it in relation to Pakvashya. So, yeah. So, towards the end, as we move, when we move from Vamana to Virechana to Vasti to Nasyam. As I mentioned, the role of Nasyam as, when we see the women is definitely towards the, late, unlike if she is affected with the Urdu Jatru Vikara, otherwise, as a part of womanhood, definitely, regular practice of Nasyam is important, has to be advised when we tell our patients, especially when they are moving from the menopause to the old age. Definitely see, Gaurave Shirasaha Shule, Vibandheshu indriyeshu cha jirnajvare ruchikaram kuryat murthavirve. This Vibandheshu Indriyeshu is the most important thing over here. Of course, whenever there is Gaurava in Shiras, Shula in Shiras, Nasim's role will be there. But this, Indriyeshu Vibandheshu. So all our Jnanendriyas, when its role comes up, comes down. And Manas, which is more subtle in a female, which is an Ubhayendriya. So at all these level, Nasim has got a role. So we must definitely practice as a preventive protocol. Our prescription we have to think our prescription. If this HPO axis, hypothalamo pituitary ovarian axis kind of thing similar, we have our prana, samana, apana axis. So this prana, samana, apana axis, whenever we see there is a link between this samana to apana to samana and then prana, the role of Agni, the role of Nasim has to be brought up. Yeah. So I think, Bahi Parimarjana I have not taken up here. But the fact that when we think of a female, since she is Agni dominant, she is Pitta dominant, the role of Rakta Mokshanam, now I am practicing this hijama, wet hijama as well as dry hijama, which is a modified kind of Rakta Mokshanam I see. Whenever see, skin so red in the background, we could see the skin is so dark and red in the background. It says Rakta Dushti. So this is always there in the female. So, at OP level only, if it is even dry hijama, we can practice. With internal medication, still, when you do your Ushna Snigdha, your Shita Ruksha, nothing works. Rakta is involved in that background. This can be practiced. So, Rakta Mokshana, which I am now practically at OP level doing at the level of hijama, whether it is wet or dry, both will have a great role in women. And I think one undiscussed area in the female thing is, the changes that happens in a woman. In the present day context, we are very less, we are very less aware of it. We have cinema ads wherein, if you use a pad, you can run like anything. If you use this tampon, you can box or jump or cycle like anything. That is told, but the fact remains that it is not absorption of the menstrual blood that is important. Rather, the physiological changes that happens in a woman, which every woman experiences when they move through their cycles, that has to be tenderly handled upon. So I think if not anyone else as a community which has this understanding of human life at different levels, how far should we be sensitive to this particular issue? When we say, during Ritumati Charya, we have to be following the Charya, avoiding excessive physical strain, avoiding all Pittakara Haras, eating very lightly, maintaining proper hygiene, having good sleep. All, you sleep on the grass mattress and all those told in our Samhitas. How relevant is the principles behind it in the present day? I think we need to really think of, and when we compare probably 50 years before and 50 years now, the statistics say the percentage of menstrual issues in females are increasing. We have at least, you take 10 women, 1 woman will be either with a DUB or a fibroid kind of things, and discussions on is the not following of this Ritmaji Sharia being a reason for further issues which we are seeing, which I think at least being Ayurveda physicians, we need to observe. So of course, our roles of a female is changed. Just tendering the children and having food at home, she has today become multitasking, having different positions at different levels. Of course, BHU, every institute is a representative of that. So I think with that sentiments, with that core of discussing Ritumati Charya and how should we follow it, which we have to be more sensitive, or I think observing as Ayurveda physician, my conclusion would be, let's celebrate womanhood with more inclusiveness, more inner strength, with more, mental and emotional well-being. This part I have always seen, a woman is always mentally and emotionally more sensitive, and at the same time I had many times observed that when a male ego is hurt to a great extent, whether it is in workplace or any other place, even though our space from 20 years beyond is better now, I think we have not reached as it should be. Still, to a greater extent, our society remains patriarchal. The fact remains that patriarchal, when I say feminism, I don't mean to, I as a female myself, as a person, I mean, as a person, as all of you see many lives in and around. Feminism, I don't see it as to be a female becoming a man. No, female is important. Female has her own specialities in terms of her tender qualities of caring, love, emotions, inclusivity, etc. But at that same time, that should not be her limitations. Rather, that should be her freedom of expression. So many a times, this patriarchal background that we already have in our society, and still, we would see even in our Ayurveda field, we have 80% females. Whenever there is a committee coming up or whenever there is a program on stage, 80% will be males only. The reasons could be many, whatever it could be. So tending to the emotional needs of a people, of a female becomes an important thing even at the workplace, I feel. So respecting women at all levels and being inclusive ultimately would definitely bring a better society. So I think as Ayurveda physicians, we must all tend for that. Exercise regularly, eat healthy life, reduce stress, drink plenty of water if that could be our thing. May sky be the limit of all female. So our ideal paradigm would be a very healthy, happy women community, playing multiple roles effortlessly, active, socially committed, competent as competent individuals. But the fact remains that we still have lots and lots to do, miles and miles to go. Thank you.
For our students. And of course, on the International Women's Day, you have shared a very good aspect of Panchakarma from the childhood to the menopause. And of course, for the Panchakarma, you have shared the proper placement of Vamana, Virechana, Basti, Nasya, and Attamokshan also. So of course, that is very useful lecture for the students. And I really thank you for sharing your knowledge with us. And of course, being from government Ayurveda college, I feel proud that yes, I am also from the same college. It was a very good lecture, Dr. Ramya. And there are some questions. I think you could answer that. There is one question from the Kirat.
The short
Female age of 36, RA factor positive, or that is quantity 49, uric acid 7.9, and the complaint of stiffness and pain in the joints, mostly knee joint and low backache. Kindly tell the line of treatment. Otherwise, Kirat, if you can unmute and ask the question directly to Ramya also.
Yeah.
Okay, thank you so much, ma'am, for such a nice lecture. Actually, there was a patient coming to my OPD. She is an IT worker, and her husband was on night shift, so she's also staying with him. And she, from 2 months, actually, she's on leave because her baby is 4 months old, but she is not lactating. She gave her formula milk, and she's having complaint of joint stiffness and pain. No swelling was there, and her RA factor was positive, and on quantitative analysis it was 49, means normal range in that is 30, and her uric acid is serum uric acid is 7.9, but CRP factor is only 1, and ESR is 40. So, ma'am, please tell the line of treatment for her.
So what are the basic presenting complaint, Kirat?
Ma'am, only stiffness and pain in joints.
I think lifestyle correction has to be there generally. Okay. And then because this night out, you have to take take care of, when she has food, when she has bath, what is her sleeping pattern. These have to be taken care of as such. And I think if these things are taken care of, we have to think of Vatanulomanam. Apana is working out whether she is passing motion regularly or not, because only that happens. The other see, ultimately we have to correct the Dhatu Parinamam, no? If there is a shofam, so from rasa to rakta to mamsa, that parinamam has to be corrected. So in that perspective, first we have to correct Agni. So naturally, if we see Agni is not corrected, we usually go for Gandharvastadi and Vaishvanara Churnam only for first 2 weeks. Along with that, Dashamulam Peya we give. If something local tenderness is there, you can go for Nagaradi, or if Pittanubandham Jadamayadi Lepam, Nagaradi Lepam. The protocol, see, the medication that we practice may not be the same, but principles can be the same. So you can use whatever medication is available in that background. So some external Lepa can be given and tend to the Agni at that level, maybe Dashmula Peya and Gandharvastadi Vaishwanara for 2 weeks, and observe how she is improving. And then next, once Agni is corrected, then I think we can go for next set of medication. Like, Rasna Saptakam with Nagara Churnam, which has Jango, Urutriga, Prashta, Parshashuli as indication. Rasna Panchakam, Same, Sandhyasti, Majjage, it is told for Rasna Panchakam. So Rasna Panchakam internal can be given. And then if you want to trigger a little more Agni, Amritarishtam plus Punarnavasam can be added and given internally. So I think that spectrum will be doing it. And sometimes in some females, I see good results with Krimihara Chikitsa. Okay. So 2 things that usually practice, I mean, I'd observed in females is, other than the general Amahara Pachana spectrum of medication, Krimihara with Krimignavadi or medicines like Vedanga Krishna, the Vedal Veradi Kashayam and all is there, Nirgundyadi Kashayam. Because whenever we give this Krimi Hara Chikitsa, it actually this is usually seen in this myofasciitis kind of patients only. It actually corrects the Dhatu Parinamam only. So when we go for Krimi Hara Chikitsa, the patient responds positively over there. And a few cases wherein, if the Samprapti Adhisthana is not Sharira, it is not Deha, if it is Manas, we definitely have to go for Manasamitram, Kalyanakam, etc. So identifying that also becomes important. Yeah.
Okay, thank you, ma'am. Her actually tongue was clear, and her bowel movements were
Next is
also
from
clear.
Basil Johnny.
Is also
He's asking about the Rashida patient. It was very unique kind of presentation you have done, like presented Rashida. He's asking whether you have stopped all other medications when she became pregnant.
No, I didn't get. What was the clarification needed?
When the patient,
Rashida, I had she was only on allopathy. I mean, she was only on our medication, no allopathic medication.
But the thing is that, madam, during the pregnancy time, no, when she conceived, so that time whether we stopped our medications. So that was I was asking.
Okay, once she started with, she became pregnant. Did we continue? I continued medication. After she became pregnant, no, then I had consultation with our Prasuti Tantram. Because she was having her joint pain per se. Okay, so so they told the initial Arishtam and all was not given. Shatyadi Pachana Kashayam was the thing. So that was continued, no issues. And other antenatal, she continued antenatal in our hospital itself. Since she got conceived with our medication, she continued antenatal itself. Yeah.
Thank you, madam. Thank you.
this Dr. Ramya, Rashida patient was just a kick actually. Like when there is the Kafanu Bandha, we usually stick on to the Virechana. So the Vamana gives this.
That's what. We usually have the sense of, external. When we admit, generally joint pains, Padrakta, Amavada spectrum. So naturally either a Sadhya Virechana or Anulomana with external Rukshana Vasti, that is. So Vamana is never thought of in that spectrum. But that was a thing that actually supported all clinical presentation. Yeah. So that is.
In clinical practice, it is always there. Like Panchakarma will act as a miracle. You
Yeah.
never know like what will work where. Like
Yeah, yeah.
was such a case when I was in Delhi, one patient came for the rheumatoid arthritis only. Then I told, okay, we'll go for the Virechana. Then on the day of administering Virechana, she told, ma'am, actually I'm having secondary infertility also. I have only one girl child. She is now 11 years. We are trying for the second baby, but it's not happening. And because of this rheumatoid, now I'm not thinking of it. Then I thought, okay, you don't know. May this Virechana will clean your all the body. So you may have the resolve your secondary infertility also. Then we gave Virechana to that. And after 2 months, she came and she told me, ma'am, I'm pregnant and it's a twin.
Okay.
So it was in Delhi. Her husband came with her and he told me, ma'am, if it is a 2 girls, we don't want this baby. Then I told, see, my first thing is I did Virechana for rheumatoid arthritis. If she is pregnant, okay, that is the good part of the Virechana. You should continue, not to terminate. Then they continue it. And after, I think in COVID, in April month, she delivered 2 baby boy.
Okay.
So that I now also that patient is in connection. They kept name as a love kush. So I always tell her, see that we don't know what is Panchakarma doing, but it is always doing miracles in practice.
Yeah. Correct. That's it.
Thank you so much from our department also and from my students. I can see the faces of my students. They are very happy to listen from you. Thank you, Dr. Ramya.
Thank you for the opportunity. Thank you. Okay. So happy Women's Day to all of you. Okay.
All of you, and of course, we have made this Women's Day more brighter for us.
Thank you.
Thank you.
Thank you.